Consultations and procedures really bring my attention to the vast amount of knowledge that I want to impart to you that I don't think I have in certain videos. So this video is about the aging of the lips, and it is brought to me with a couple ideas. I just saw a lady today, 76 years old, for a hair consult as well as a face consult, and she said from the face component that she wanted to have her lips filled. And actually what's interesting is that I could still see my filler in her lips. She said, "How do you know what fillers look like?" I said, "That's what I do for a living." And I thought they still look natural, they look really nice. She probably thought they went away, but I can see my filler there, not overdone. But I knew that it would not have helped her to do another round of fillers. And what she really needed or would benefit from were surgical procedures around her lips rather than more fillers. Now, why is that, and what kind of surgeries are we talking about, and when would I do it for her? So for her, I would really recommend, I recommended for her at 76 years of age, if it was within her budget desires, because she was quite healthy, was to look at possibly a facelift. But for the reason why I didn't want to do fillers for her is her lips were relatively full. Now, if you looked at them, you probably think, "Doc, there's no way the lips look pretty flat to me. Why would you want to do it?" It's a relative decision. But when I looked at her, she had a very long, wide upper lip. It hung over her teeth. And I knew that the best option I had to make her lips look younger was a combination of small surgical procedures. I would do a lip lift, which is an incision underneath the nose. It heals very well. Corner of the lip lift to try to bring the corners up a little bit, because this lip lift does not address the very tail of it. And then a V to Y lip advancement for the bottom lip, where I do a small incision inside the lip to advance it forward. I just did this on an 80-some-year-old lady last week who flew in from Florida, and that's the other reason I thought of this video, is to sort of explain my philosophies with each of this, is when I do one or the other. Now, she came in because she had bad silicone done that was overdone, and she came in for a lip reduction. And she says, "Well, when you reduce the lips, you're going to shorten this white lip." I go, "Well, that's a lip lift. That is totally different from a lip reduction." In fact, if I just did the lip lift and no lip reduction, her lip would actually look weirder. It would have exacerbated it. So obviously I would not have done that. So I did a corner of a lip lift, a VY advancement on the bottom lip, as well as the upper lip lift. So to address, and then I also simultaneously did the lip reduction. I always do the lip lift first so I can exaggerate up where that problem is and then finesse it with the lip reduction. So I can do those simultaneously, but the sequence is the lip lift first. Which sounds weird because I'm augmenting a lip and reducing it, but it's a balancing. And for bottom lip, I did the same thing. She had these two weird balls here from the silicone, so I cleaved those balls down, softened them, and then I advanced the lip forward. To have you understand a concept of this is a few things. One is teeth show. So in a younger patient, they typically have a lot of teeth show on the top. As we get older, this lip gets longer and it covers the teeth. So you want to try to show more teeth, especially when you smile. And also the lip lift will shorten the white lip and also roll the red lip out. So all those components are very powerful. On the flip side, you don't want to show bottom teeth. What's interesting is we get older, we have lip incompetence where the bottom lip hangs out like this and you show more teeth. Think of an older politician or something. I always have this in my mind, an older white gentleman, you have this teeth showing out here. So what I do is I would cover the bottom teeth and expose the top teeth. How do I do that? I do a lip advancement for the bottom lip, which there are incisions inside. They're called V to Y advancements. So essentially, if you think of a V like this, when I move the V tissue out and close behind, it becomes a Y, and that moves the lip forward. It covers up the teeth. I can't promise you complete coverage. I can't promise you complete exposure, but it moves you in the right direction. So you want to reset the balance. So teeth show and teeth hiding the bottom and showing the top, are integral to the success of the procedure. I do have little incisions that I take out at a week, so if I'm out of town, I really would like you to be here for the week. And to me, it's part of a general balance when I'm looking at facelifts and other components to have those all integrated there. I want to talk about incisions that are not acceptable, because a lot of times you hear the word lip advancement, lip lift, and you go, what are incisions that scar poorly and cause problems? I recently had an actress from Hollywood that came in that I did a lip reduction on, and her upper lip looked really distorted, and the reason is someone tried to do a lip advancement. If you make an incision in the middle 80% of the lip, especially where there's this vermilion border and you want to do advancement of tissues, it does not look right. It looks really weird. Okay, so do not make an incision in the middle on the border of the lip, anywhere in the middle 80%. The corner of the lip lift, which is on the border, just to bring the side up a little bit, is very safe. It does not lead to that kind of scarring that looks deformed. But any borders in the middle 80%, especially the top lip, does not look right. And that's a procedure that I really think is outdated. I really think it's a terrible decision. I mean, in the past, when I did my fellowship in 2001, my mentor always said the only candidate for that is an 80-some-year-old lady that doesn't mind wearing lipstick to cover the scars. And I would still be very cautious and say, I don't think that looks good on anyone. I think it causes a deformity and distortion to the lip that doesn't look right. So can you use fillers in addition to all this to further augment it? Sure. Once I've gotten the lips well positioned, I think it's worth considering to do it. What are some reasons to consider all three procedures, corner of lip lift, central lip lift, as well as a lip advancement? The reason is several things. So balance. When you take the lip lift and bring the center portion up, the sides will look a little saggy, especially if they've got a pretty big downturn. You don't want what's called a rabbit deformity where the center is lifted, so you want to bring the corners up. How about the bottom lip? Why is that a problem? Because when you look at an older lip, if you show more of the red lip in the center, this could look too full vis-a-vis the bottom lip. And the bottom lip, especially for someone older, I mean, even over 30 years of age, the bottom lip should always be bigger than the top lip. So you don't want the top lip to be so big that now it's disproportionate. Now, if you've got a 20-some-year-old, they may just do fine with the lip lift and nothing on the corner of the lips and nothing on the central bottom lip because they have such fullness. They just want a little shorter lip and more exposure there to get a balance to this. So, but that is another reason to do it, to do the bottom lip advancement, which again is from the inside of the mouth, to create a little bit more balance so the top lip doesn't become too full, which is a dead giveaway when someone's just had a lip lift, they haven't done work on the bottom lip, or at least fillers in the bottom lip. If you don't want to have that, and you could do the fillers, but fillers alone are hard to cover that bottom teeth. So to me, I like this combination of several procedures to get the best results out there. Sort of lip balance in terms of size and also teeth show are sort of the two major things to understand. When would I not do a lip lift? So I have to remove at least 4 millimeters of tissue to make a decision. So as a general idea, especially if you have a ruler, you want to measure this, I need to leave at least 11 millimeters of top lip behind to permit functional improvement. So functional stability. If I go try to take it down less than 11 millimeters, we'll have a problem. So I need to leave at least 11 millimeters behind. I also need to remove at least 4 millimeters of tissue. If I'm only removing 2 or 3, then it's just not going to make enough difference because you lose about 1 or 2 millimeters after the elevation. I saw a lady today who's been my patient for many, many years, and she asked, should she do a lip lift? She saw this before and after float by in my front office lobby, and I looked at her in 1 second. I said no. I could already see, even though she was in her mid-70s, I looked at her, and she's been my patient a long time. I looked at, there's not enough distance. I can eyeball it and already tell you. Sometimes I can't eyeball it. I'll take a caliper, which allows me to measure things, and within about a minute, I'll tell you, should I do it, should I not do it? And that really depends on the length of the original white lip. So I need a minimum 4. I prefer 5 to 6 at a minimum. I usually don't take more than 9. That's pretty aggressive. Usually on average, I'm taking 6 to 7 millimeters out. But if I'm taking less than 4, then I won't help you, and I need to preserve at least 11. So if you measure your distance and you've only got 12 or 13 millimeters, for example, from the base of the nose to the top of the lip, I would already tell you don't bother for me to do the procedure because there's probably not going to be enough substantial difference. I can go much deeper into the procedure. I just wanted to give you some general guidelines in terms of aesthetics and in terms of philosophy.